The anatomy of the skull. In the adult, the skull consists of 22 individual bones. The brain case consists of 8 bones. These include the paired parietal and temporal bones, plus the unpaired frontal, ethmoid, sphenoid, and occipital bones. The parietal bone forms most of the upper lateral side of the skull. These are paired bones, with the right and left parietal bones joining together at the top of the skull. Each parietal bone is also bounded anteriorly by the frontal bone, and posteriorly by the occipital bone, and inferiorly by the temporal bone. The temporal bone forms the lower lateral side of the skull. The temporal bone contains some important landmarks. The external acoustic meatus, or ear canal, is the large opening located on the lateral side of the skull that is associated with the ear. The internal acoustic meatus is an opening located inside the cranial cavity on the medial side of the petrous ridge. This connects the middle ear and inner ear cavities of the temporal bone. The mandibular fossa is a deep oval-shaped depression located on the external base of the skull, just in front of the external acoustic meatus. The mandible, or lower jaw, joins with the skull at this site as part of the temporomandibular joint, or TMJ. The frontal bone is the single bone that forms the forehead. The occipital bone is the single bone that forms the posterior skull and the posterior base of the cranial cavity. On the base of the skull, the occipital bone contains a large opening called the Foramen Magnum. The Foramen Magnum allows for passage of the spinal cord as it exits the skull. On either side of the Foramen Magnum is an oval-shaped occipital condyle. These condyles form joints with the first cervical vertebrae and thus support the skull on top of the vertebral column. The sphenoid bone is a single complex bone located at the center of the skull. It serves as a keystone bone because it joins with almost every other bone of the skull. The sella turcica is located at the midline of the middle cranial fossa. This houses the pea-sized pituitary gland. The ethmoid bone is a single midline bone that forms the roof and lateral walls of the upper nasal cavity. It also creates the upper portion of the nasal septum and contributes to the medial wall of the orbit of the eye. Within the nasal cavity, the perpendicular plate of the ethmoid bone forms the upper portion of the nasal septum. Extending from each lateral wall are the nasal concha. These are thin, curved projections that extend into the nasal cavity. In the cranial cavity, the ethmoid bone forms a small area at the midline in the floor of the anterior cranial fossa. This portion of the ethmoid bone consists of 2 parts, the Crista Galli and the cribriform plates. The Crista Galli, which means rooster's comb or crest, is a small upward bony projection located at the midline. This structure functions as an anterior attachment point for one of the covering layers of the brain. To either side of the Crista Galli is the cribriform plate. The cribriform plate is a small flattened area with numerous small openings termed the olfactory foramina. Small nerve branches from the olfactory areas of the nasal cavity pass through these openings to enter the brain. A suture is an immobile joint between adjacent bones of the skull. The long sutures located between the bones of the brain case are not straight, but instead follow irregular, tightly twisting paths. These twisting lines serve to tightly interlock the adjacent bones together, thus adding strength to the skull for brain protection. The 2 suture lines seen on top of the skull are the coronal and sagittal sutures. The coronal suture runs from side to side across the skull within the coronal plane. It joins the frontal bone to the right and left parietal bones. The sagittal suture extends posteriorly from the coronal suture, running along the midline at the top of the skull in the sagittal plane. It unites the right and left parietal bones. On the posterior skull, the sagittal suture terminates by joining the lambdoidal suture. The lambdoidal suture joins the occipital bone to the right and left parietal bones and the temporal bones. This suture is named because it resembles the Greek letter lambda. The squamous suture is located on the lateral skull. It unites the squamous portion of the temporal bone with the parietal bone. The facial bones include 14 bones, with 6 paired bones and 2 unpaired bones. The paired bones are the maxilla, the palatine, the zygomatic, the nasal, the lacrimal, and the inferior nasal concha bones. The unpaired bones are the vomer and the mandible. The maxillary bow, or maxilla, is one of a pair that together form the upper jaw, much of the hard palate, the medial floor of the orbit, and the lateral base of the nose. The palatine bone is one of a pair of irregularly shaped bones that contribute small areas to the lateral walls of the nasal cavity and medial wall of each orbit. The plates from the right and left palatine bones join together at the midline, forming the posterior quarter of the hard palate. The zygomatic bone is also known as the cheekbone. Each of the paired zygomatic bones forms much of the lateral wall of the orbit and the lateral inferior margins of the anterior orbit opening. The short temporal process of the zygomatic bone projects posteriorly, where it forms the anterior portion of the zygomatic arch. The nasal bone is one of 2 small bones that articulate with one another to form the bony bridge of the nose. Located at the medial eye orbit, the lacrimal bone is a small rectangular bone that forms the anterior medial wall of the orbit. The right and left inferior nasal concha form a curved bony plate that projects into the nasal cavity space from the lower lateral wall, and can easily be seen when looking into the anterior opening of the nasal cavity. The Vomer bone is unpaired and is often referred to more simply as the vomer. The vomer is triangular shaped and forms the posterior inferior part of the nasal septum. A much smaller portion of the vomer can be seen when looking into the anterior opening of the nasal cavity. The mandible forms the lower jaw, and it is the only movable bone of the skull. At the time of birth, the mandible consists of paired right and left bones, but these fuse together during the first year to form a single U-shaped mandible. The posterior projection is the condylar process of the mandible, or mandibular condyle. The condyle of the mandible articulates or joins with the mandibular fossa and articular tubercle of the temporal bone. Thank you for watching.